people think that if you have aesthetic treatments, you're going to look unnatural or you're going to look fake. The person who's sitting just opposite you on the bus, chances are they've probably had an aesthetic treatment and they look good, but you can't tell. When you can tell what's been done and it's over-exaggerated, that's when work starts to look fake and sort of unnatural. You should maintain some uniqueness of your face. Treatments shouldn't be sort of like a cookie cutter approach to each face. We always highlight somebody's individuality as well. We don't try and completely change them into somebody else. When you solve that thing, it's life-changing. They're looking good, they're feeling good, they probably have received compliments.
Today, we're joined by Dr. Arun Karwal, the founder of Karwal Aesthetics in London. Welcome to Social Untold. Hope you're all doing well. Aesthetics isn't about changing yourself. It's about enhancing your natural features and feeling good about yourself. Today, we're joined by Dr. Arun Karwal, the founder of Karwal Aesthetics in London, who specializes in non-surgical treatments. We'll be talking about the most popular procedures, clearing up myths about fillers and Botox, and exploring future of aesthetic medicine. So if this topic interests you, keep watching. Dr. Karwal, how are you?
I'm good,
Welcome to
thanks.
Social Untold.
Thank you so much for having me, Tamika.
Great, pleasure having you. So I'll start with my very basic question. Why did you get interested in aesthetics, and particularly why non-surgical treatments?
Right, okay. So actually, funny enough, the plan was actually to go into surgery initially.
Okay.
So I was, when I was a young kid, maybe 16, 17 years old, I was considering, what career choice am I going to make?
Yeah.
I had a uncle who's based in Scotland. He's a maxillofacial surgeon. So I used to go and see him in Scotland and actually shadow him in surgery as well.
Okay.
So it really inspired me to also follow this path. So I went to medical school, completed medical school, and then after this chapter of my life, I started working in the NHS. And I think I was very quickly sort of disillusioned by what the training route is for surgery. There was a lot of problems, that I found. Things are not exactly how I thought they were going to be.
Okay.
So at that time, I started to explore other types of careers. So obviously surgery was still on the table.
Yeah.
I was looking into A&E as well. I always wanted something that kind of involved sort of manual dexterity, so using my hands to do the work. And then I started to research other things, and then aesthetics popped up. And I started to see sort of very, very interesting, a lot of very interesting procedures and very interesting results as well. They were so almost like as good as surgery, but the amazing thing was that you were able to do these treatments very quickly and minimal downtime, minimal swelling. And it was just really amazing to see that you could do such minimally invasive treatments without surgery, really.
Yeah.
So I started to explore this. I then went on to started doing some courses in aesthetics alongside working in A&E the whole time. And, first couple of years, I didn't do a huge amount with aesthetics.
Okay.
I probably only saw like maybe 2 or 3 clients in the whole year.
Okay.
Later on, I started to take it a little bit more seriously. And I took more and more courses. I started seeing more clients. I got a job in a clinic. So I was seeing like hundreds of patients per month in this clinic.
Yeah.
I then later left, and then I started my own business.
Okay.
And I've, developed, more and more skills along the way. And here I am.
Great. Okay. Tell me, with all your training in aesthetics, and you've been working for a couple of years now in the industry, what are the myths that people still believe for the aesthetic industry?
I think one of the biggest myths is that people think that if you have aesthetic treatments, you're going to look unnatural, you're going to look fake.
Yeah.
But it's completely untrue because, the person who's sitting just opposite you on the bus, the person who's sitting opposite you in the tube, chances are they've probably had an aesthetic treatment and they look good, but you can't tell because it's good work. When you can tell what's been done and it's over exaggerated, that's when work starts to look fake and sort of unnatural.
And that's when it's not done correctly.
Exactly. Yeah.
Okay. So it depends on.
So what I'm saying is, good work.
Yeah.
You shouldn't be able to notice it.
Yeah.
It should just blend into your natural features.
Yeah.
And not stand out.
Okay. What are the most popular procedures that you perform?
Well, I mean, it's changed a lot over the years, but now I would say majority of the work I'm doing is for under eye problems.
Okay.
So under eye hollowing, under eye bags. So it's using a dermal filler to restore volume around the eye.
Yeah.
That's one of the most popular treatments. Another one is, of course, non-surgical rhinoplasty. A big insecurity for a lot of people. A lot of people don't like the bump on their nose, or they don't like the shape of their nose.
Yeah.
That's another one. We also have just recently introduced something called Endolift. So Endolift is another non-surgical treatment. It utilizes a laser which melts away stubborn pockets of fat on the face. So it's very, very interesting. And then I would say the fourth one that's very popular. So actually we deal with quite a lot of complications of dermal fillers. So some people, they'll come from other clinics with some filler that's been done and it will be maybe uneven or it's causing swelling. So what we do is we use ultrasound to locate the filler and we can dissolve it away.
Okay. And do people get infections because of fillers done in wrong places?
I've never seen an infection after fillers, personally. I've seen some bad infections after something called thread lifts. Have you heard about this?
Yes, I have heard.
Thread lifts, I would say, I've seen some complications from that, but I've never seen an infection from fillers.
Okay. And is there a particular age that people should start considering having these procedures, or anyone can do at any time?
I mean, there's no specific age. All of these treatments are very bespoke. So, if you are younger, so let's say if you're in your early 20s, you might be considering things that are going to sort of prevent aging or prevent the signs of aging, such as maybe Botox or some of our more sort of like skin treatments, like skin boosters. So this will be more appropriate for sort of like that younger age group. But the age range goes up to, we have clients in their 60s, 70s that are still having treatments. But of course, it's going to be a very different type of approach. So we will likely be restoring more volume on the face where they've lost volume, or sometimes treatments are a little bit more aggressive so that it can have more an effect, tighten skin.
Does it ever happen that a patient comes to you asking for a particular procedure, but you as a professional realize that that's not what they need and recommended something else? Yeah,
definitely. All the time. Yeah. I would say, especially with, as I said, we get a lot of clients who have issues with their under eyes. So a lot of the time people will think, yes, dermal fillers are going to solve the problem. Yeah. Or another one is, I think polynucleotides is going to solve the problem. Okay. But, usually when I see them in person, it's completely different approach we need to take. Sometimes it can start with just a topical cream. It can be, sometimes it's fillers, sometimes it's Botox. So we're always sort of taking a very holistic approach to all treatments. Yeah. A lot of the time people can be sort of, they don't always know what's the best thing for the problem. So they do need some bit of guidance sometimes. So do they take your advice, or are some patients stubborn, like, oh no, sometimes, yeah. At the end of the day, you could always go to a different clinic and get whatever treatment you thought was in your head. Yeah, but you would never perform if you feel it's not right for them. Exactly, yeah. I'd only perform a treatment if I feel like it's in their best interest. Yeah, okay, that makes sense. Quick question. Do you think I have an issue with my under eyes? No, I think your under eyes are great. I'm fine? Okay, perfect. Good. No, there's no hollowing, there's no hyperpigmentation. Yeah. So no, your under eyes are perfect.
Okay, perfect. So how do you basically decide if a patient does need a treatment? Have you ever sent patients away that, no, you don't need anything?
Definitely. Yeah. If there truly is nothing to do, then I'll tell them do less, do nothing.
Yeah. But sometimes patients do come with insecurities, right? They've just seen someone online and they want to look pretty like that person, like, influencers and everyone online on social media.
Yeah.
So how do they react when you tell them that they're okay, they don't need any treatment?
It depends. With some clients, they will sort of just accept that.
Okay.
Whereas others will still be quite insistent that I need to do something for them.
Yeah.
So I think sometimes it is just as much about counseling that patient that everything's fine here.
Yeah.
And, I mean, the wrong thing to say is that it's all in your head, because most of the time clients won't take that well. They don't want to hear that something's in their head.
Yeah.
They need, you need to reassure them properly that, for example, if their under eyes are looking totally fine, like yours, for example, your under eyes are great.
Yeah.
You might just need a bit of reassurance that, it's fine. You don't need to do anything. And actually on that topic as well, I find that nowadays people are starting to feel more self-conscious as well, because since COVID, everyone's a lot more people are working from home. So they've got a screen in front of them all the time.
Absolutely.
So that can affect a lot of people's mental health, I think. And people are video calling a lot more. And what I find is that typically when you video call, or when you're looking at on a video call, you're kind of looking down.
Yeah.
And usually you're going to see more shadows on your face, such as under eyes. You're going to see more shadowing. Your nasolabial lines, you're going to see more shadowing. So automatically you will assume that that's how everybody else is viewing you. But sometimes it needs reassurance as well. People come in and they're looking at the mirror, where you should be looking at your mirror like this,
like that.
But they look down like this. And that's when you see a lot more of the fat pads descending. You see more shadowing on your face. So I always have to bring the mirror back up and say, this is how actually you look. It's not down here. Nobody looks at you down here. It's up here.
Yeah, that makes sense. How important is facial harmony for you when people come to you for procedures? Because what happens is, like, patients look people online and see beauty trends.
Yes.
Everyone is looking like a certain face, like there's a mold.
Like a
I feel like
there's version.
Yes, exactly. These days I feel like everyone's looking the same.
Yes.
I don't know why. Like, how can 60% of the population look same? If I look at celebrities, they just look same.
Right, yeah.
And if we look back like 20 years from now, every celebrity had a different sort of, body, the facial features that they had.
Yes.
And it was good.
That's it, yeah.
It was good.
I totally agree with you. I mean, so I never encourage people to chase trends. You should maintain some uniqueness of your face.
Yes.
Not everybody needs to be... treatments shouldn't be sort of like a cookie cutter approach to each face. Everybody should have a slightly different treatment approach.
Yeah.
And obviously one massive trend is, well, it's really starting to die out now, but having really big lips.
Yeah.
Of course, that was really big at one time.
True.
But yeah, it just doesn't suit every type of face. So exactly like you said, it's more about making sure features are in harmony with each other, rather than seeing some trend on Instagram. It might look good on this particular face, but it might not look good on your face.
Yeah.
So I think it's really important to get a good consultation, and see if this specific thing that you are that you've seen online is actually going to suit your face.
True. And how do you see facial harmony in a patient? Like, do you do scans, or like, is there anything else that you study?
So, I mean, there are scanners you can get nowadays where you will do like a 3D analysis.
Okay.
I personally don't use it. I just do this all manually. So I just I'll bring you in, sit you down on the chair.
Yeah.
First of all, you'll tell me if there's any problem areas or areas that bother you. Then I will pretty much like do a little measure up the face.
Okay.
Look at certain different ratios. I won't go too much into ratios here.
Yeah.
And yeah, that's what I'm doing. I'm looking at how does this feature fit with this feature, fit with this feature? What's the overall face shape? Is it oval? Is it oblong? Is it round? What does this face need that's gonna kind of enhance it or beautify it?
Yeah.
But staying within normal anatomical limits.
Okay. Let's talk about Botox and fillers. What's the difference?
Right. So Botox is a toxin produced by a bacteria called Clostridium botulinum.
Okay.
So what it does is it actually paralyzes muscle. So where we use it is usually on the forehead and around the eyes to relax muscle and prevent lines from forming. Yeah. So in simple terms, it's a muscle relaxant.
Okay.
It stops lines from forming. Fillers, on the other hand, these are injectable gels. They're made of something called hyaluronic acid, which is a naturally occurring substance in our own tissue. But this hyaluronic acid is made in a lab, and it comes in different densities. So you can have soft fillers, medium fillers, dense fillers. And the reason why there's different densities is because we need different densities to that will sit right in different compartments of the face.
Okay.
Yeah. So if we're going to put a filler in the under eye area, we would use a soft filler. If you're going to use something, let's say on the nose or in the jawline, you want something very dense because you want it to have that bony look.
Okay. And how long these treatments last? And what's the maintenance like?
So Botox, you're looking about 3 to 4 months.
Okay.
So you can have a treatment once every 3-4 months or just twice a year if you like. Fillers, well, this one, it depends. So typically, as a basic answer, I would say 12 to 18 months. Okay. But the real answer is a lot more complex than that because...
So it would depend on patients?
Depends on patients, depends on the filler type.
Okay.
So dense fillers will last longer. Soft fillers won't last as long.
Okay.
Also depends on the area of the face it's been injected. So if it's lips, for example, this area moves a lot more. It'll wear off faster.
Oh, okay.
If it's on the nose, for example, or in the jawline, these areas don't move so much, so it'll last longer as well.
Okay. And are there any risks with these treatments?
Generally, they're very, very safe. So you can expect just a bit of mild bruising and swelling for maybe 2 or 3 days.
Okay.
Of course, there are slightly more dangerous risks. I mean, the one that we all worry about is vascular occlusion. So this is when a vessel has been blocked by a filler. Okay. And if a vessel is blocked, it can cut off blood supply to a certain part of the face.
Oh my God. Okay.
I know it sounds very scary, but the good thing about fillers is that we can always reverse them. We can locate the vessel and we can dissolve away the filler that's in that.
Is that risk like a very quick risk after the treatment, or does that take time?
If a vascular occlusion is suspected, usually you will suspect it right there and then.
Okay.
So you'll see a paleness to the skin. And when you see paleness, that means there's restricted blood flow to the area.
Okay. And these sort of things happen when you go to unqualified professionals, right?
Well, I mean, it can even happen if you go to a qualified professional.
Okay.
It's with the face, it's a massive network of vessels. So even though we make sure we inject in areas we know there's no important vessel, there's always a chance of still hitting a vessel because, like I said, there's vessels everywhere.
Yeah.
So, even in the hands of experienced professionals, it can happen. But the important thing is that you need to go to someone who knows how to deal with it if it happens.
Mm. And if a patient is not happy with the treatment, is it reversible in the same sitting, or do they have to come back again?
So if it's an emergency, like vascular occlusion, that needs to be dissolved straight away.
Okay.
If it's just a cosmetic thing that they don't like, so let's say they feel it's uneven or something, then I would really recommend you wait 2 weeks, because in 2 weeks, your swelling is completely gone.
Okay.
And sometimes the swelling can make things look uneven. So that's why I would say give it 2 weeks before you think about dissolving this away.
Okay. Okay. And do fillers always make you look fake?
When it's done correctly, it should never make you look fake.
So it should be minimal then, right? To make it look very natural.
I would say,
because obviously if I get a treatment done, right? My best friend who sees me literally like every week, she would notice it if it's like a drastic one. But would she notice if
it depends how observant she is.
Yeah, that also.
I mean, no, what I always say is that if a treatment's well done, the people around you, so your friends, family, they shouldn't be able to point it out and notice it. They should notice that you look better and you look more refreshed.
Yeah.
You look rejuvenated, but they shouldn't be able to pinpoint exactly what's been done. That's where I think things can look a bit fake.
Okay. And it's Botox just for older people? Like that's a 50 plus?
No, not at all. Not at all. It can be for young people and older people.
Okay. Okay. And you were saying Botox is for the forehead part, right?
Yes.
Is it done somewhere else in the face as well?
Yeah. There's a lot of places. So we can use it on the forehead, around the eyes.
Yeah.
We can use it on the nose, the chin, a big muscle called the masseter.
Yeah.
We can use it in the armpits as well.
Okay.
To stop sweating.
Okay.
We can also use it to relieve migraines. So there's a lot of other points on the head and around the neck we can use for migraines.
Yeah.
We can use it on the palms, on the soles of the feet to stop sweating. Where else can we use it? There's a lot of other places as well. Also, Botox is not only a cosmetic thing. It's also used in the hospital as well. So people with blepharospasm, so if they're having twitching eyelids, also if they have bladder issues, it's also used for that as well.
Yeah.
There's tons and tons of uses of Botox.
Okay. I know someone who got a treatment done and the doctor suggested a little bit of, I think it was Botox around the smile area, like the smile line.
Okay.
And that got really weird for a few months. She couldn't smile.
Okay.
That was very weird because we used to take pictures and it used to look like she's trying to smile, but she couldn't.
Okay.
That was very off. So yeah, is that a common place to do Botox as well?
In the right candidate. I'll be honest, I don't do a huge amount of Botox around here because of that problem that you just described.
Yeah.
I think it looks unusual when people can't speak properly, they can't drink from a cup properly.
Okay.
So I think Botox is usually better used in the upper face because you get less of those kind of problems.
Okay. And these non-surgical treatments, they are done with injections as well, right? If we talk about fillers, are they pain-free?
Very tolerable. I would say maybe 1 or 2 out of 10.
Okay.
So you feel a little sharp scratch, sometimes a bit of pressure.
Okay.
But yeah, very well tolerated.
Okay. And in your patients, what do you see after the treatments and the enhancements that they get? How does their life change?
Well, I mean, I would say the main thing is there's a confidence boost. So you see it, when they come back after 2 weeks, when all the swelling settled down.
Yeah.
They're looking good, they're feeling good. They probably have received compliments from people because they look better. So yeah, that's the main thing. It's a big confidence boost. Usually people come because they're feeling self-conscious about something.
Yeah.
And when you solve that thing, it's life-changing.
Have you seen any patient of yours whose life just changed drastically after that?
Oh, for sure. Yeah. Like I said, we deal with a lot of under eye problems, and I find that the most sort of transformative thing for somebody, because when you just talk to somebody, you're looking directly at their eyes most of the time. So if your under eyes are looking tired, if there's bags, if it looks dark, it makes you look kind of tired, ill. And then if we're able to reverse that appearance and make it look refreshed, bright, awake, that's a big thing for somebody. And you normally see that straight after the treatment because the result's instant.
Okay. Okay. How do you handle stubborn patients who come to you with, unrealistic expectations? Just make me look like, some celebrity. How do you deal with that?
I don't get a huge amount of people coming in sort of with that attitude.
Yeah.
Because I think a lot of my clients have already found me on Instagram. And because we put out quite a natural we put out very natural results.
Okay.
They're subtle as well. And you might also notice that we always highlight somebody's individuality as well. We don't try and completely change them into somebody else.
Yeah.
So that's why I don't think we get people coming in saying, I want to completely overhaul my whole appearance.
Yeah.
I want to look like a completely different person. Because it's, maybe some clinics, they do put that out there. And probably those clients are going to those clinics instead.
Yeah, true. About going to the right professional, what do people look for when they're finding a practitioner to go to for these procedures?
Right.
And where should they look for? Because, Google is huge.
Yeah. I would say there's a few things, if you're considering an aesthetic treatment, I said there's a few things you should look for. So, of course, this one's obvious, but just make sure whoever is doing a treatment is actually medically trained.
Okay.
And you can check this. So if it's a doctor, they'll be registered on the GMC website. If they're a dentist, it'll be GDC. And if they're a nurse, it's going to be NMC.
Okay.
So make sure they're actually professionals. Then you can also look at other things. So you can look at their Google reviews. You can see what other people are saying about them.
Okay.
If they've been happy with the treatment so far,
Yeah.
Trustpilot. And I'll say probably one of the most important things is actually looking at their work and looking at their results. Does their idea of beauty and does their aesthetic ideal match yours? If it doesn't, and their idea of beauty is warped compared to yours, it's not going to be a good match.
Okay.
Because they're going to have a completely different idea of what looks good on you.
Yeah.
So I would say that's arguably the most important thing, looking at their results and seeing, do I like these results?
Yeah. Okay. And when patients are actually booking the treatments, what are the red flags that they should keep an eye on?
Red flags.
Yeah.
So, of course, non-medical practitioner. Of course, fake-looking results, unnatural-looking results. And another thing, this is kind of controversial as well, but I would say if the prices are extremely low, this should also send some alarm bells off as well. Because if you think about these aesthetic products, so Botox fillers, generally they are quite expensive.
Yeah.
And they will have to be purchased through a pharmacy. If the price is extremely low, then it should make you think, is this actually a legit product? Why is the price so low?
Okay. Makes sense, yeah. Because the quality of the product might not be of the high standards.
Of the right standard, yes. Yeah. And then, of course, the reason why aesthetic treatments are also expensive is because the training of your practitioner is also going to be insured. You'll also be paying for clinic rooms, or he might have a actual clinic to run. So there's a number of overheads that a clinic has, and that will be reflected in the price of the treatment.
Okay.
If this is extremely low, chances are you at the end of the day you get what you pay for.
Yeah, makes sense. And how important is the aftercare?
Oh, very important.
It could be a situation where the doctor performed a really good procedure, and once the patient goes back, they're not taking care about their face or whatever.
Yes.
And would that affect the
definitely
end result?
Definitely, yeah. So yeah, adhering to the aftercare, very important. Generally, most of these treatments are very safe anyway. So even if you slightly deviate, nothing super bad is going to happen.
Okay.
But the main things we advise: no alcohol, no exercise for about 24 hours.
Okay.
And that's mainly to bring the swelling down. Because if you think about it, swelling and bruising, sorry. So Because if you think about it, alcohol thins your blood, more chance of a bruise.
Yeah.
Exercise is going to increase the amount of blood flow to the area. That's going to make bruising and swelling worse.
Okay.
And then hot showers as well, that can also make it worse. And then lastly, the reason we say don't lie down for 4 hours, especially after Botox, is because we don't want that product to move to other muscles and affect other muscles.
Okay. What aesthetic trends are gaining popularity right now?
I would say at the moment...
I think some would be dying down, like you said earlier.
Yes.
But like, can we talk about both, actually?
Yeah, I would... To me, I would say there's 2 or 3 that I think are really trending up now.
Okay.
One is polynucleotides. So it's
I think I've heard about it, but I can't remember what that is.
So it's a skin booster treatment.
Okay.
It's an injectable skin booster. The product's derived from salmon sperm DNA, and it just improves skin quality. Really.
Okay.
I'll say that one's trending quite a lot now. Another one that's kind of really, it's quite an old product, but it's really surging at the moment. It's called Sculptra. So this one is it's made of something called poly-L-lactic acid, PLLA. And this one, it improves collagen levels throughout the tissues in the face.
Okay.
So if you're looking, I would say more for a slightly older client who's lost a lot of her facial fat, his or her facial fat pads, and maybe looking a little bit gaunt, a little bit skeletal. Sculptra is fantastic because it really kind of plumps up all of these fat pads of the face, in simple words. I'd say one more is really trending. I'd say Endolift. This is one of the devices, the first device I actually ever bought.
Okay.
So it's the laser device that melts stubborn pockets of fat on the face. So that's one. I would say these 3 are trending.
Okay. And can you share like the price points for these procedures?
Yeah. So
maybe rough estimates.
Polynucleotides, you're looking at about 300 to 350 per session.
And how many sessions would a person need?
Usually 2 or 3.
Okay.
Yeah. With Sculptra, I think I'm just going to introduce this very soon, but I think it's around 600 per session.
Okay.
And I think you only need 1.
Okay.
And then Endolift, so it depends on the area of the face, but let's say most typically lower face and under chin, 2200.
And that's 1 session?
That's 1 session.
Okay.
And results last 3 years or more.
Okay. That's good.
Yeah.
Do you think patients these days are tending towards more natural looking procedures, or do you still see patients who want to, still go for that old class?
Yeah. I would say definitely there's more of a trend towards much more natural look. But there is, still a minority of people who still kind of like that thing.
Yeah. Okay. Any non-surgical techniques or, in new innovations that you're very excited about?
There is one new type of Botox on the market. It's called Relfides.
Okay.
We'll be introducing this in the next few weeks. The special thing about it is that it lasts so long. So normal Botox lasts 3 or 4 months.
Yeah.
This type of Botox, Relfides, lasts 6 months.
Okay.
So that one is great.
Okay.
A lot of clients will really like that.
And would this be costly compared to the usual Botox?
I would say maybe tiny bit more.
Okay, but then doubling the amount of time that you would have with that makes sense.
Exactly. That's right. Yeah.
Okay.
That means less visits to your clinic.
Yeah.
You probably only need to go twice a year. So very convenient for life.
Okay. And I don't see any involvement of AI in future with this industry, but do you think it would help in any way? I mean, maybe the machines would have some incorporation of AI. I'm not sure.
I mean, I don't see robots doing the treatments. That's one thing. But I definitely think AI, well, I suppose it's already doing it. AI, I guess, is helping to show you where changes need to be made on the face to optimize your appearance.
Okay.
So I suppose we're already seeing that in a way through things like filters and other types of apps.
Yeah. Okay. Or maybe, I don't know if you guys have patient reports. So
Patient-
maybe like reading that, like 3D scans, maybe
We
helping
do, yes.
reading
Yeah,
that
there
as
is
well.
one called Observe. I'm not sure if it uses AI though.
Okay. I personally feel like AI is just, kind of getting into every industry.
Yeah.
And in some time, maybe in future, like 15, 20 years,
Yes.
it would be just there everywhere. And you said you don't see robots doing the procedures. I doubt that.
Maybe. You might be right.
I really doubt that. Okay, one piece of advice for our audience who are actually considering these aesthetic procedures, especially non-surgical treatments. Do you have any advice for them?
Yeah, definitely. I would say take your time. Don't rush the process of finding a aesthetic practitioner.
Yeah.
So do your research on them properly. Make sure you have a look at their reviews, look at their results, and make sure they are aligning with what you want to achieve.
Yeah. And I think it's also about finding the right practitioner, qualified practitioner for the treatment that you think you want.
Exactly.
Because some people would be best at, let's say, treatment A.
Yes.
And if you want treatment B, so maybe there's another practitioner who's specializes
You're exactly
in
right.
that. So
Yes, yeah. So you see
well.
one practitioner who might be doing only noses, or majority noses. Another one doing majority of jawlines. Another one mainly under eyes. Another one endolift. Another one lasers.
Yeah.
So exactly, you're right. You want to, whatever you want to achieve, make sure they're doing a lot of that first.
Yeah. Okay. And where can people find you if they want to reach out to you?
Most people find me on Instagram. So you can search my account. It's Karwal_aesthetics. We also have a website, so www.karwalaesthetics.com, and we soon will have some YouTube videos coming out as well.
Great. Thank you, Dr. Arun.
Thank you.
This was great speaking to you.
Thank you so much.
Shared a lot of information. I hope this was helpful for our audience. Guys, if you have any questions, please do leave it in the comments, and we'll try Dr. Arun to get to answer those questions if we can.
Yeah, of course.
We'll leave his contact details in the description. So if you want to reach out, you can find that information in the description box. And if you still haven't subscribed us, please hit that subscribe button so we can keep bringing more information, great podcasts to you. Thank you again, Dr. Arun.
Thank you for having me.
It was a pleasure to have you here. And I will see you next time. Take care. Bye.
Bye.